be starting on the sites, and we've got our in-house hair team over there working under the microscopes with the strip and making individual grafts. And then what I'm doing is this whole area is just sparse. There's been a lot of history of skin cancer, some sun damage, and then just some genetic loss. And this isn't that uncommon among my female patients. I'll see this a lot. So this whole area needs to be filled in. And so I'm going to be making sites with this special tiny blade. And I've got her numbed up so I can just make these little poke holes. And in each one of those, a hair follicle is going to be placed. Okay, so this is the strip of hair that's been harvested, and it's already being slivered, meaning divided up into individual rows under the microscope. That's what Julie's doing right now, and she can see the individual follicles. With this technique, you can just get a single row of hair with all the roots preserved, and then we'll be able to make those into single grafts that we can transplant. And here Angie is taking those little narrow strips that Julie has created and dividing them into individual follicles, trimming them so that there's not a lot of extra tissue, and then placing them aside. And we'll count those individually and make sure we have the number that we're planning on.